Hello, fellow nurse educators. I am Annalisa Sumayo, and today I will present the project titled Case-Based Approach in Managing Multimorbidity in Adults. As we all know, healthcare systems are growing more complex due to factors like an aging population, the rise in chronic diseases, and the increasing prevalence of multimorbidity, which create considerable challenges for nurses in providing effective care. In this session, I will explore how incorporating a case-based approach alongside innovative teaching methods and interprofessional collaboration can enhance nursing students' clinical judgment and decision-making abilities, which will prepare them to manage complex clinical situations and ultimately improve patient outcomes and safety. This educational innovation addresses the growing complexity of healthcare systems, which, as Kennedy and colleagues in 2023 highlighted, is driven by factors like an aging population, rising chronic diseases, and technological advancements. According to Swift in 2021 and Billings in 2020, nursing students, particularly those early in their career, often struggle to apply theoretical knowledge in clinical judgment and decision-making skill in complex clinical situations that lead to gaps in patient safety. To tackle this, the project integrates case-based learning, problem-based learning, flipped classroom, interprofessional collaboration, and technology to enhance students' critical thinking and decision-making skills. The project will be implemented in the Adult Health Medical Surgical Nursing course and targets undergraduate nursing students to equip them with the skills needed for managing multimorbidity in real-world clinical scenarios. The course content will be delivered in a flipped classroom approach through a web page I created that features various multimedia resources and learning resources that cater to different learning styles using Adobe Express and will be refined with feedback from students, faculty, instructor, and from the mentor. The project is based on cognitive learning theory, which according to Gandhi and Mukherjee in 2023 stresses active engagement by linking new information to existing knowledge in incorporating metacognitive activities such as reflection and strategy modification. This approach is essentially critical in nursing, where students must apply theoretical knowledge to complex clinical scenarios, as Paz and Van Merienbauer in 2020 emphasized. Key components of the theory include active participation, knowledge construction, and metacognition, all of which, according to Soragi and colleagues in 2024 and Sharma and colleagues in 2023, improve retention and decision-making skills. Rashwan in 2023 and Shan and colleagues in 2021 highlighted that case-based and problem-based learning, along with a flipped classroom, encourage engagement and enhance critical thinking, while interprofessional collaboration and technology integration improve communication, teamwork, and educational outcomes, as described by Martin and Bryant in 2023 and Chacon and Johnson in 2020. Moreover, Martin and Bryant in 2023 added that incorporating social determinants of health and interprofessional education ensure students are equipped to handle patients' complex health and social needs. Students' ability to apply theoretical knowledge will be assessed through problem-based scenarios presented on Google Classroom as formative evaluation, reverse case study scenarios that are also presented on Google Classroom, the Interprofessional Collaborative Competency Attainment Survey, open close parenthesis ICCAS, and the Performance Assessment Communication and Teamwork Tools, open close parenthesis PACT, will be used as summative assessments. Students will analyze a case study of a patient with multimorbidity and complex health needs. The task is to assess the physical, mental, social, cultural, economic, and spiritual aspects of the patient to provide holistic nursing care, identify relevant nursing diagnoses, create a holistic care plan, and collaborate with interprofessional team members to ensure that the patient's needs are met. The care plan will include nursing interventions, address social determinants of health, evidence-based guidelines, and involve interprofessional collaboration. The students will be grouped into teams of 10 members using random group creator, random group generator application. Once the groups are formed, they will work together to discuss and develop the care plan for the assigned case study. They will be required to collaborate effectively with their team members and respect each other's input and perspective. Students will create a Word format file of the case study and send it via email to me. They will also present the case study on a multimedia platform or interactive platform of their choice and send the link of the presentation to my email address, and I will be the one who will distribute the link to the entire class for them to have access to presentation, and will therefore provide feedback during classroom instructor-led discussion. Rubric will be used as an evaluation tool for both problem-based learning and case-based learning group work, and a total score of 30 that represents a meets expectation level for all criteria will be the benchmark for the reverse clinical case study and problem-based clinical scenarios to demonstrate satisfactory and proficient performance. The intended outcome of this project include enhanced critical thinking, clinical judgment, and decision-making skills as students engage in case-based and problem-based learning by applying theoretical knowledge to complex clinical scenarios. Increased confidence will be fostered through active participation, which will allow students to connect theory with practice, while interprofessional collaboration will improve communication and teamwork, which are essential for safe patient care, as Kruger and colleagues in 2023 and Leader and colleagues in 2022 noted. Additionally, Saragi and colleagues in 2024 found that students will gain a better understanding of social determinants of health, open close parenthesis SDOH, and incorporate these factors into case studies while developing proficiency in managing multimorbidity through a holistic person-centered and collaborative approach. Group work and assessments, including formative problem-based scenarios on Google Classroom and summative reverse case studies, interprofessional collaborative competency attainment survey, open close parenthesis, ICCAS, and performance assessment communication and teamwork tools, open close parenthesis, PACT, will evaluate students' critical thinking, teamwork, and communication skills required for safe clinical practice, as Kruger and colleagues in 2023 noted. Reflection is a key component of clinical learning, which enables new nurses to identify their strengths and areas for improvement, according to Gruby in 2023. Student feedback will be collected through an online survey that I developed, which will be used to evaluate the effectiveness of the educator, the strategies, and the learning resources, and will identify areas for improvements as suggested by Beware and colleagues in 2020, while ongoing collaboration with mentor will refine the teaching approach to better prepare students for real-world clinical practice and the NCLEX RN exam, as revealed by Kulus and colleagues in 2020 and Ross and colleagues in 2024. This comprehensive evaluation will provide insight into the effectiveness of the teaching innovation in enhancing clinical judgment and decision-making skills.